If we talk about infections, the breastfed infants, like you said, have benefits when it comes to the prevalence of infections during the first year of life. So there's short-term benefits when it comes to preventing upper respiratory disease, otitis media in particular, and those things. If we're talking about development in general, we're also talking about brain development or cognitive development, and there you also see a difference just after 1 year. So it's relatively short term. Long term, we see a difference in many of the chronic diseases that we don't want to see. We see certainly obesity increasing in those that have formerly been formula fed. We see more type 1 diabetes, type 2 diabetes, cardiovascular disease, such things that are long-term. You see a difference. Even if there are socioeconomic factors that differ between breastfed and formula-fed infants, if you try to control for those confounders, there are still differences in long-term outcomes, which we would like to try to minimize as much as we can. I am fairly convinced, even if I don't have evidence, that it's the protein concentration of the formula, because in principle, virtually all formula-fed infants are hyperinsulinemic. That means that they have higher serum insulin than breastfed infants. That is, my guess, would be a predisposing factor for obesity, and we know that obesity is a predisposing factor for type 1 and type 2 diabetes. So anything we can do to reduce the protein content without having any adverse effects would be beneficial in a long-term perspective, I believe. On the other hand, it's difficult to do those studies because we can look at infants during the first year of life, but then to follow them up to 6-7 years when they start school, when they're teenagers, those studies are very costly and very difficult to do. But those are the types of studies that we need to do to confirm what I said is my suspicion and hypothesis, that the high protein intake will have long-term adverse effects.